call the meeting over and call on Captain Broughton, listen to the pledge of allegiance.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call roll.
Councilor Brown.
Here.
Councilor Weaver.
Here.
Councilor Broughton. Here. Councilor Watson.
Here.
Councilor Barton.
Here.
Mayor Lovelace.
Here.
We have a quorum to do business.
Approval of the minutes of the April 13th meeting.
Mayor, I offer motion to approve the minutes of April 13th meeting.
Motion by Councilor Watson, second by Councilor Broughton to approve the minutes of the April 13th council meeting. Is there any discussion or any changes to be made? Hearing none. Councilor Brown?
Yes.
Councilor Weaver?
Yes.
Councilor Broughton?
Yes.
Councilor Watson?
Yes.
Councilor Barton?
Yes.
Motion carries and the minutes are approved.
I'd like to welcome our visitors here today. It's good to see you. I'm glad you're here. On the new business today, we've asked Bob Ellis, Director of Nursing at the hospital, to give us an update on the COVID-19 epidemic.
Okay, now talking about COVID-19, I thought I'd begin just by giving you all a timeline of what's been happening at the hospital. On March 17th, we began screening. We closed our front door on March 17th. We began screening outside on the north end of our building under the ER reporting shift. Anyone entering our building, whether they were ER patients, clinic patients, visitors, or patients coming for lab work or radiology services, they were screened there. And what we mean by screening, we ask if you had any symptoms, and then we check their temperature. ER patients who come in and we ask these questions, if they had anything that said yes or had a temperature, they were then escorted around to the other end of our building, to that end of our building under the ambulance entrance there, where we set up a secondary treatment area. There the patients could be seen by the nurse and then by the doctor and treated right there at that spot. If they were only coming around, because the treatment is you just treat the symptoms. And then if they decide to be tested, we could test them outside and never have to bring the patient inside if we were only going to do a nasal swab. If patients then needed more testing, such as lab work or x-rays, we brought them either into our decon unit, which is right off the ambulance bay, or we brought them into the regular negative pressure room, our isolation room in the ER, which is room 5. So that's how we got started. The ER screening area is staffed 24 hours a day and has been ever since 3/17. And so anyone entering the building, on that end of the building, is screened. On March 19th, 2 days later, we added our employees and we added a secondary screening station on the other end, on the south end of our building. We staffed that area twice a day during the shift changes. We screened about 300 patients, 300 people a day during both of those areas. Also, around about that time in mid-March, we suspended elective surgeries at our hospital. So we have only done emergency cases or cases that can't wait since that time. Our GI and urology clinics were also canceled in mid-March. Oncology was not, though, because those patients with cancer, they on treatment regimens that can't be interrupted, chemotherapy, and so those were continued. Those have been continued throughout. Also in mid-March, we saw our inpatient volumes just plummet, and they dropped dramatically, and we have been only averaging about 14, 15 inpatients a day. Since then, sometimes even less. On the inpatient side, we have had 17 patients admitted with suspected COVID-19. 15 have been screened, 15 have been tested and are negative. We have 2 in the hospital now that test results are pending on. Now, as of this morning, we have totally tested 147 patients at McMillan Hospital for COVID-19. We've resulted in 137. 134 have been negative. We have had 3 positives. As of this morning, we had 10 cases pending. 7 of those 137 that we've tested have been employees, and thankfully all have been negative. Now, as of 1:30 this afternoon, the Alabama Public Health says we've had 26 positive cases here in the county and 1 confirmed death in the county secondary to COVID. And I can tell you that death did not occur in either one of our Escambia County Healthcare Authority hospitals. Atmore has had a much higher rate. For some reason, there is no explanation why they've had more than we have, but they've had a much higher rate of positives at that end of the county. Now, our plans, we planned a lot. So far we have not had a positive patient admitted to the hospital. Because the plan is to, if you come in and get tested, is to go home if possible. But our plans, if we do have a positive inpatient, someone that cannot leave, is to reopen our downstairs nursing unit. It's been closed since 2011. But to really only reopen 2 rooms. The rooms right outside of administration, the rooms that are closest to ICU, are both negative pressure rooms. And so our plan is for our first 2 positive COVID inpatients to go there. And when our inpatient count goes to 3 or above, that is when we will convert our ICU unit into a COVID unit at McMillan. The ICU has the ability and the capacity now to be a totally negative pressure unit that can be converted by our engineering team. At that point, we would also have to convert our sleep lab unit, which is only 3 beds, into a step-down ICU unit because you still have patients come in and have other issues, particularly cardiac issues that require drills. So those patients have to be kept and they'll be monitored in those 3 beds. Thankfully, I have several ICU nurses who now go on to other roles out in hospitals, like radiology nurse or a recovery room nurse. Those will be repurposed and helping us staff that step-down ICU units. Now, the issues we face in resolving in is inpatients use large amounts of PPE, which is personal protective equipment. So that's why we've made every effort not to admit patients unless they're just totally needed. We have really 2 major issues concerning PPE and 1 other issue. Our 2 major issues are N95 masks and isolation gowns. We have bought N95 masks from anyone who will sell them to us. That's including nail salon, tattoo parlors, etc. Owen Milliken, he's been very helpful to us in getting N95s. And he's also allowed us to use a portable UV unit, which has helped us to decrease the amount of time to get a room clean. UV light is specific and kills the virus. And when we initially started, you'd have a suspected patient in a room. When they go home, you had to leave the room just sitting there for an hour before you could touch it. And then you cleaned it as usual. Now with the UV light, we push it in, we turn it on, and 15 minutes later we can be in the room cleaning. So it's helped our turnaround time, particularly in the ER. Now surgical gowns are another major issue. Regular isolation gowns are on short supply nationwide. So in many instances, we're using surgical gowns because that's all we have to put on. Thankfully, we've had plenty of those. How we able to purchase those is all on allocation. So if y'all run businesses, y'all understand that. You can only get what you have historically used in the past. So this crisis doesn't increase the amount that you can buy from your vendors. So if I used 10 cases in a month, that's all I can buy in a month, even though I may be going through 50 cases now in a month because of the COVID. So that's how it works. So, but thankfully, the Alabama Public Health has supplied us some gowns and also has been completely helpful. Muscogee Industries and Porch is now converted some of their work, and they are providing gallons. We received our first order today, I believe, from them of 400 gallons, so that will dramatically help us as we take care of patients. Now, I have to say the community's been wonderful. From the day Steve Layton did the interview with Mr. Owens, our administrator, and I asked if the community could help me with hands-on math, I've received hundreds since then. I'm close to probably 1,000 since then. What we did with those is we supplied our staff, and now we have them in the screening areas, and anyone who shows up to go to ER, lab, radiology, we give them one to take home with them if they need it. Because we think putting masks on us inside the building has been the best thing that's happened. Because what it does, it doesn't keep you from getting the virus, but if I had the virus, it'd keep you from getting it from me. That's what a mask would do. I mentioned Owen earlier, and he has been great. Not only has he helped us with the mask, he's also helped us get some full and partial face masks, the big units with the filters on the side. We'd use those if we had positive inpatients, and he's helped us get some of those. Lee Knowles has also been very helpful, and he's also helped us with these face shields with the filters and getting some Tyvek suits that we would use when we had positive patients as well. Numerous people have fed us. I mean, I have Miss Patel particularly has been very forthcoming in feeding people everywhere in the hospital. The guys from Popeyes and George's and Count 31, they made the chicken one Saturday. Not only did we feed the hospital, we fed the Brewton Fire Department and Police Department, East Brewton Fire Police Department, and the Sheriff Department because they had so much chicken that day. So they've been very, very nice. Other people that's helped us is the school system has been very helpful in providing us, because we send all this stuff to school, our kids, the hand sanitizers and stuff. When schools were closed, they had those in storage and they provided those for us. We were down to none, and now we have hundreds of bottles of hand sanitizer. The other thing I said, the other need we have is the sanitary wipes. The wipes we have, we cannot get anymore. They've gone to New York City and other hot spots. And so we're down to using Clorox wipes to clean our equipments and stretchers and all this kind of stuff. The schools gave us what they had, and we've been able to get a small amount before, but that is about the only other thing that we really have a need for. Alabama Power has also been very helpful in getting us surgical masks and gloves, and there's just been so many others who've just come by with, Mr. Bob, I had these 6 masks put back, I'm gonna let y'all have them. Y'all need them more than I do. There's been so many just little stories, just too many to mention. Now going forward, we're hoping for at least a partial reopening of the state sometime in early May. What that would do is it would allow us to resume our clinics and especially being able to do day surgery. What I mean by day surgery is someone comes in to have a hernia repair. Well, those people have a hernia repair, they go home that same day. We've canceled all that now also just because we're trying to keep people out of the building. But we're hoping we can begin day surgery again sometime in May. Of course, all these people who are coming in, either they're going to clinics or they'd be screened first before they were allowed in the building. We expect to be outside screening for some time. I wish I could tell you when it would end, but it's undetermined. We anticipate through May, maybe into June, we'll be outside screening patients into the building. We do expect a spike when the state is reopened, and we also expect a spike again in the fall when cooler weather gets here. The fall will be compounded by our annual flu season, so we expect to have COVID and our annual flu season all at the same time. We've had this one time before. We had an annual flu season and we had swine flu all at the same time, so we have faced it one time before. We're hoping for a reliable antibody test. You see it on the news, they've got tests. They do have tests, but the one that's out there is just not specific for the COVID-19 virus. It is a test that tests to see if you've ever had coronavirus, and there are numerous varieties of coronavirus, and so it doesn't really give you the information you need. And of course, like everyone else, we're hoping for a vaccine in the next year or two that'll just be part of our annual flu shot. So I'll be glad to answer any questions about the hospital and about the county, as far as COVID is concerned.
Bob, what you were saying is that if y'all have a positive patient, you're doing your best to ship them somewhere that would take them at the
Well,
moment?
you know, the issue is, you don't know if you got a positive patient for about 2 days,
Right.
2 or 3 days. You test, and the test will get back sometime, generally within 2 to 3 days. Our patients, so far, we've had no issues in transferring patients, particularly the ones that have come in and had to be intubated and shipped out. So we've had no issues getting them a bed, and particularly in Pensacola. We transfer to Pensacola, while Akron transfers to Mobile. If you want to go to Mobile from Brewton, you have to, Lawrence would have to tell me, Bob, I want to go to Mobile, because we got to go to Pensacola, because it's 60 minutes away instead of 90, and we've had no issues so far in getting patients into the Pensacola hospitals.
Okay. Well, what I'm reading, I assume most people are, that, vaccine would be great, but it may be some time off.
It's going to be a couple of years away at least.
Right.
Right.
Okay, any other questions? We appreciate all you're doing at the hospital.
thank you.
And I appreciate you taking time to come see us
Thank y'all for
today.
asking me to
Thank
come.
you, thank you.
Thank you for your support. Appreciate it. Thank you.
As we all know, the federal government has passed several bills funding for this COVID virus, and we hired a company to help us lobby, I guess you would say, for any funds that we could possibly get from that. And Brooke Harden, who's our CFO, is working directly with that company. And although it's early in the process, I just wanted to give a quick report to the council on information she might have.
Thank you. Unfortunately, we're not as far along as we'd like to be due to the weather issues we had last week. The poor girl had a tree hit her house, and then she was without power, so we're not as far as we'd like to be. But what she has sent me is a probably 10-page survey on what we're looking for, what we want them to look for us. And my goal is to give her every grant we have this year, what grants we've got in the past. But our focus right now is COVID-19 funding, since we have purchased quite a bit of equipment, masks, gloves, anything that would help businesses, we have tried to do that. So unfortunately right now, the funds that have come down from the federal level are being given directly to the state, and the state disperses those. It's not coming directly to municipalities. Jessica Taylor, who is with this company, who's been working with me, is in constant contact and watching the funding for the next wave. There's supposed to be another phase coming down, and I know that there has been a push for funding for municipalities for lack of sales tax revenue, lack of lodging tax, and all of those things. So right now, it's still all very up in the air, and that's really why we hired this company. It's hard to keep up. It's changing every day. I get an email every day from them saying what's happening at the federal level. So that's really what they're here for, is to keep an eye on that, so we're not the last ones to find out, because we are small, and we want to make sure we know first. But that's what our goal is right now. They will be working with us though over the next year, and so any grants that come up 6 months from now that are applicable to our city, they will be able to let us know. So it's not just that we hired them just for COVID-19 funds, it's for the entire year. But I'll be happy to answer any questions. Like I said, we're not as far along as I'd like us to be, but unfortunately the weather was not our friend last week.
As y'all know, we've always had somebody that's helped us on the state level, and we've always done very well through ADECA and other agencies. It's just when they started at the federal level, when they got into these $1 trillion funding bills, is when we felt we needed to be a part of that, and so we'll see how that works out. But I appreciate what you've been doing with her, and hopefully next week she'll have better weather than she had this week. The city has been partnering with New Beginnings and also with Caring Hearts of Pensacola, and we have been giving food, serving about between 600 families,
Yes.
600 to 700 families at a time. Councilor Barton has been working with that on behalf of the city. We're doing that again this week, Thursday, May 21st, at Fisher Center, and
Yeah.
then this Thursday
New beginning.
at New Beginnings, and
It will be at 10 o'clock this Thursday.
right. So, and you don't have to get out of your car. You just circle the building, they put it in your car. You never have to leave your car, and it starts at 10 o'clock. Is there anything else needs to come before the council? If not, the meeting is adjourned.